So do your knees and ankles swell when you walk long distances? They're persistently swollen, stiff. Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video where we're going to be talking about how to reduce swelling in your knees and ankles. Sorry to disturb you, but if you like my videos, if you have a problem in your knee and shoulder, if your family member or friend has a problem in the knee and shoulder, please call the number given in the description. My team can help you fix an appointment with me in person or online. Thank you. Swelling in your knees could be due to a myriad of causes. Could be injury related, infection, arthritis, aging, because of which swelling can happen. Ankle, also the same reasons, or if you've sat for a very long time in a train or keeping your legs dangling for a period of time, they could swell up. Now, when they're swollen up, it's important to identify certain emergent situations like infection, where you need immediate treatment for either. So you have fever, redness, a lot of pain with swelling, please rush to the doctor. Maybe you require some antibiotics, maybe you require something else, maybe even an operation to get rid of this swelling, which may be detrimental to your joint. If it's the other reasons, let's talk about it more in detail. Now, why does swelling happen? Swelling can be because of swelling around the skin or subcutaneous tissue, that is a tissue just below the skin, muscles, etc. Or it could be coming straight from the joint. When it's coming from the joint, it's usually due to the buildup of lubricant fluid within the joint. Now, lubricant is there to reduce friction in your joint. It is produced by a covering in the joint called the synovium, which has little cells in it. When they get irritated, either by an injury, either by aging, either by an arthritis, they start producing excessive fluid which gets accumulated, much like tears in your eyes, but tears can flow out. The tears of the knee can't flow out because there's no access to the external environment. So what should you do first? Rest the part. Okay, when you rest it, load reduces, and as a consequence, the apparent swelling will stop increasing at a rapid rate. Ice it. Icing acts as an anti-inflammatory, so putting ice will reduce swelling. Compress it, so you could apply a crepe bandage or a brace, etc. This brings the joint together and reduces swelling. Elevate it. So elevation is once you put it up, swelling tends to reduce as there's no dependency, as everything follows the law of gravity. So when you elevate it, it's opposite of gravity. So because of gravity, the blood flows towards the upper part of the body. Of course, you could also take certain over-the-counter medicines like anti-inflammatories, etc., which are available, trypsin, bromelain combinations, which can reduce your swelling. So what exercises could you do to reduce swelling? If it's because of dependency, etc., ankle pump exercises help. Little bit of straight leg raising exercises help, either straight or lying on one side, especially for chronic swellings. Third is certain exercises for your knee. Maybe the swelling because your knee is getting overloaded. So if you increase the strength of the compensatory mechanisms, which are the muscles, the load on the knee can reduce. How long does it take for swelling to come down? So if it's an acute injury related swelling, it usually should come down in about 4 days or so, 4 to 5 days. If it's a chronic swelling due to degeneration or aging, it can take 2 to 4 weeks to come down if you follow the right regimen. So weight reduction is a medically proven way of reducing swelling, especially of a degenerative nature. If you're heavy, the load passing through an already aging knee will be more. If you reduce the load, the knee degenerates less, is subjected to less loads, and stops crying, meaning swelling stops in your knee. There's certain medically proven foods also that you could take, like turmeric, omega-3 fatty acids, blueberries that have antioxidants that can reduce swelling over a period of time, especially in those with a degenerative nature, because degeneration is an oxidative process. These are antioxidants. So what does oxidative process mean? So whenever something degenerates, it requires oxygen to degenerate. So when you put antioxidants, it prevents this oxidation process from happening and can reduce degeneration, can reduce pain. This has no side effects, so no harm eating the right foods like turmeric, blueberries, omega-3 fatty acids, cod liver oil, etc. So what should you strictly avoid in swelling? So if it's acute swelling, avoid heat, etc. Avoid over exercising that part, ignoring the swelling, continuing to exercise, walk, etc. Give it rest, follow the R.I.C.E, rest, ice, compression, elevation. If it's chronic, start exercises gradually. Use ice packs initially and heat only later if it's chronic swelling. I hope you got quite a bit of information about causes of swelling in the knee, how to tackle it. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular Hindi channel with a silver play button. Please like, subscribe and follow it. Thank you.